So, in trying to talk about some autoimmune issues that could actually, you know, go on in pregnancy, most of the times, rhesus factor incompatibility. There's a test which you can do to actually help diagnose this condition. Like the test will tell you if there is a mixture of fetus blood and maternal blood. Now this is what is known as a Kleihauer Betke Test. Kleihauer Betke Test. Alright, so you could see that a blood film that was actually gotten as a result of the test. Now this blood film is showing a mixture of adult cells, and it's also showing a mixture of fetal cells. So just kindly try to talk about how you can be able to do this test, and also how you can be able to differentiate or know when you see fetal cells and also when you see adult cells. So it's just so you know, it's a specialized blood test. It's used during pregnancy to dictate and measure fetal red blood cells in maternal circulation. Alright, so it's actually like if the baby's blood goes into the mother's circulation. Okay, so it's especially important in cases of fetal maternal hemorrhage, when the fetal blood are actually crossing into the mother's circulation. Alright, so the issue is actually from the baby to the mother. So in a way of trying to differentiate, of course, the densely stained red blood cells are the ones that are actually the ones of the fetus. So how it works is that the test relies on the fact that fetal hemoglobin is more resistant to acid than adult hemoglobin. So in maternal blood smear is treated with acid. Alright, adult red blood cells lose their hemoglobin and appear as pale ghost cells. Do you understand? The adult cells become pale, but the fetal red blood cells, they will still resist. Okay, they will retain their hemoglobin and still be bright pink. All right, so technicians count fetal red blood cells under a microscope just to estimate. This will now help you know the amount of bleeding. Do you understand? Amount of red blood cells that actually went into the mother's circulation. So why it is done, right? Most of the times is to determine the correct drug to give, all right, in cases of all those rhesus incompatibility. It can also help you know the extent of trauma, all right, because the amount of fetus red blood cells in maternal circulation should actually indicate the type of issue that is on ground. It can help you investigate the causes of stillbirth, fetal anemia, and neonatal jaundice. So if it is negative, no significant fetal red blood cell detected. If it is positive, fetal red blood cells is present. So the test is quantitative. All right, it's not just all about positive and negative. Okay, it can help you also be able to determine the amount of bleeding that actually went on.